Um, but it was brought up on last month's Emergency Preparedness Committee meeting. It came up last week. Um, is Judy Duncan with us
John,
today?
can I pause you for just one quick second, just to let everyone know I am recording this meeting because I think people will want to be able to listen to it for the discussion going forward. Thank you.
Great, that's a great resource. I know we've had several folks reach out almost after every meeting and say, I missed it. Did you guys record it? So thanks for thinking about doing that, Bill, especially perhaps for this topic. So I don't see Judy Duncan, but I know that she reported at our ePrep committee meeting without disclosing any particulars or personal information that a member of the Foot Patrol had taken their life in the last month, had committed suicide, and the inference, though there were no particulars, was that that person had perhaps been suffering from some of the social isolation and loneliness, and that could have been contributing to what resulted in them taking their own lives. And I've been doing a little bit of research on this topic, and folks have been sending me articles, I think, of late, and then pursuant to last week's meeting even. And it's pretty clear from my review of the literature that social isolation and loneliness are associated with, I'm reading right now, poor physical and mental health outcomes, including higher rates of mortality, depression, and cognitive decline. So I don't think there's any doubt about it. I think the question is that what can we do as a community to help address this? And I think that I've heard often that people are reticent to ask for help, and people are also often reticent to reach out to folks who haven't asked for help. And so we're all kind of isolated, wanting to be helpful, almost, I'm certain, to a person, but not certain what to do. I think we've talked in the broader context of our emergency preparedness work about the idea of identifying vulnerable populations, which for ePrep often include pets, children, the elderly folks, and making a plan to support them, be their ePrep buddy in the context of a disaster response. And COVID's been, I guess, a slow rolling disaster, as we've talked about. And I think, people have been holding up pretty well, but it's wearing on, and maybe people's resilience is wearing thin. So I really did appreciate what Richard at the Met did in terms of reminding me that he had previously shared a flyer that their emergency preparedness committee had prepared. And you indicated, Richard, that you guys adapted this from the Red Cross's emotional response materials, and then you ran it by some of the folks who were therapists, either current or retired in your community, and maybe adapted it a bit. But in reading the version that I sent out with the invitation to today's meeting, which I guess I sent out yesterday, I can tell that you've adapted it it looks like, to acknowledge the isolation we're experiencing currently during the shutdown. So I assume that was a tweak in deference to the COVID pandemic. And it walks through some real basics, as you point out, but things that can be really, I think, impactful in terms of, maybe overcoming some of the hesitancy that we might experience as individuals to either reach out because we need support, or reach out to others who we think might need support, to make that connection. And just making a social connection and saying, hi, I just wanted to see how you're doing, apparently has tremendous efficacy in terms of really making a difference. So, I think if I think of nothing else, as a takeaway from all this, it is just to be intentional about making connections. Don't be presumptuous or assume that people are okay. It's okay to ask and see if they are, because we're all hurting at one degree or another. And so it's probably safe to assume that people would appreciate it if you did reach out to them and try to push through any kind of reticence or hesitancy to do so, because you'll feel better, and the person you reach out to or people you reach out to may well also. So, I'd love to have this be a conversation. Dick, Richard, if you want to, in a few moments here, give us any insights or updates with regard to what you guys are doing at the Met. So that's the major focus of today's conversation. But I wanted to, since this is the COVID-19 forum, I would like to start off, if we could. Ruth Ann, you mentioned in your email to me that you and Howard have been collaborating on updating, the report that you had been generating, and are going to be continuing to collaborate and refine that work going forward. But might we start off with just a status update with regard to your statistical analysis of what's happening with regard to COVID, both broadly, I guess, with regard to Oregon, and then particularly if we have time to drill down on our zip code. So Ruth Ann and Howard, would you like to take it away for the next few minutes?
Okay, everyone can hear me, I hope. So I'm going to just start out with the big numbers, the USA numbers. And again, there was a study done recently, and, they asked people how many they thought had died in the US, and people said like 1,000 or 1,500. So, it's good just to have kind of round numbers in your mind, but we're in the United States, as of the 5th, we were up to 7.4 million total cases, 209,000 deaths. That's 63 deaths per 100,000. And here in Oregon, it's 12.9 deaths per 100,000. And in the last 7 days alone, it's been over 300,000 cases. So I think Howard will get to a little bit more detail on why that's scary. In Oregon, this is of the 2nd, and you can't get any of this data on the same day. It's just not possible. So we were up to 34,163 here in the state. Over 550 deaths is something you might want to think about, 563. And there were 32,000 positive tests and 663,000 negatives. And so there were almost 700,000 people tested. I think the positivity test is what's really critical. And fortunately, Howard's going to kind of get into that with the next overview on the daily number of new COVID-19 cases, a 14-day moving average, and it's a nice graph. So Howard, you want to take it away?
Sure, thanks, Ruth Ann. I guess those charts are available on somewhere. They get posted somewhere. But to me, as an epidemiologist, the long and short of this is, are we doing a good job? Is the epidemic getting better or worse in Oregon? And the answer is, it's actually getting a little worse. We did well until Memorial Day, then there was a big rise into the summer, then it went down and it kind of bottomed out, and now it's going back up after Labor Day, with both probably the Labor Day parties and the fires and all the disruption that occurred, caused. So the number that I keep in mind is 5%. In Oregon, we need to have a positive test for COVID rate, daily test rate of 5% or lower. Much lower would be better. But that's about the break-even point where if 5% of people are testing positive, that means about each single person that gets COVID is infecting one other person. And if it's more than 5% daily getting infected, each person that has COVID is infecting more than one person. And that means the epidemic is increasing. So what we want to do is get the daily rate of positivity down below 5%. And we had moved in that direction up until Labor Day, and now it's gone back up. It's closer to 6%. And, you know, I think we just have to redouble, like the Oregon Health Department says, we just have to redouble our efforts to get that number down. And I heard it said on television the other day, forgot which was the commentator that said, you know, basically 2/3 of the cases in Oregon, 2/3 of the new COVID cases are occurring in people 20 to 49, 2/3. And that's where we have to interrupt the transmission. And the way I heard it said was we have to decide whether we want to open schools or open bars. And I think that's what we have to come to grips with, is that to interrupt the transmission of this disease, we have to interrupt what people particularly 20 to 49 are doing. That's pretty much my bottom line.
Howard, for a moment there, I was screen sharing the charts. Were there any of the charts in particular you wanted to share with the group, or was that overview sufficient for your purposes tonight?
That's sufficient. If you had the chart of the percent positive, the daily percent positive, that's the chart to me that says it all.
Howard?
I had that one up for a few
Page
moments
4.
there.
That's page 4.
Bill?
Oh, Howard, I was curious what your thoughts were. As I understood way back in March or April, it was explained to us we were in the throes of a forest fire. We tamped it down to some degree, as you said. Labor Day was of concern, and what you're saying bears that out, that we're seeing upticks now. But as I recall, the next big concern was what we're coming up into in Thanksgiving and Christmas holidays. And my impression was that those were going to be worse potential spreading events than the Memorial Day. So I guess I'm curious what your thoughts are on that. Do you see that as the concern as well?
I can see a lot of concerns. Anytime people are moving around and breaking containment, you're breaking containment. And I mean, another thing that's occurred to me, because I have 2 grandchildren in college, is colleges, if they can't control the epidemic, they may send the kids home. So that's like, the epidemic has spread there, and then you send the kids home all over the country. I think that's a potentially very bad situation. I mean, obviously, Thanksgiving and Christmas do the same thing. It's hard to imagine a Thanksgiving where 20 people get together and, how do you eat your Thanksgiving meal and keep your mask on while you're sitting in one room? I would agree. That's of concern.
Last week we talked about the twindemic and the impact of having had influenza and how that can compromise your respiratory functioning, and if exposed to COVID can lead to a worse outcome. I'm assuming that is also, given that flu season tends to be the winter months, I'm assuming that's also a factor in play here, Howard. I also read an interesting article yesterday, I think it was, that I don't know how legit it was, but it was postulating that the influenza of 1917, what's been called erroneously be called the Spanish flu, they attributed some really cold winter air in Europe to having been a contributing factor to the severity and spread of that flu. The notion being that cold, dry air is a better environment for the flu virus to thrive in than warm, humid air. And I don't know if you care to comment on either of those concepts.
I don't know that anybody knows beyond, people are pushed more closely together in the winter, why that should make the flu worse. People have actually done experiments where they chill people and do crazy things, and that doesn't in and of itself appear to alter your immunity to the flu. I think it's just that we're together and we don't get outside, and that's more why respiratory illnesses occur, in the winter than in the summer.
On the other hand, if we're all wearing masks, then that cuts down on the amount of flu. I do remember reading that in South in Australia, they've been going through winter while we're in our summer. The flu rates have been down among
Right.
the population.
Probably because everyone was masked
Right,
and distancing.
right.
Well, to wrap up on this, Ruth Ann, in your email, you said that if we had time, you'd finish up going over the zip code data. Do you want to close with that?
Yeah, sure. There's just one number. It's hold on a minute. As of the 23rd, and again, I'm sorry about the dates here, but this is the most recent one as of yesterday. There were 124 cases in 97209, our zip code, and that's 70 cases per 10,000. So I just wanted, I do that every week. And also, if people want a more detailed account to include active workplaces in Multnomah County, active care facilities, and things like that, that information is at sustainabilityadoption.com, and you can download it there. Anyway, and it's just a little longer than this report.
So that is again for September the 23rd, 124 cases and 70.5 cases per 10,000. Just
Yeah,
as reference, last week, September the 6th, the prior week, September the 16th, we had 118 cases instead of 124. So we're up in terms of case count. And then the prevalence per 10,000 was 67.1. So again, we're up to 70.5. So we've got increased cases, increased prevalence, and then as Howard mentioned, that 5% magic figure, the current data shows that we're at 6.2% in terms of percentage of tests that were positive. Apparently that's unchanged from the prior from the 16th, but it's still above the magic 5% that has been, as Howard mentioned, an indicator of whether or not things are stabilizing or continuing to escalate. So I guess does anybody have any questions or comments about that that data, which we like to provide at the top of each of our COVID forums? Would love to just pause and see if there are any questions, comments before we move on to the social isolation and loneliness conversation. Okay, well, thank you. So Richard, I'd suggested that you might want to lead off in terms of providing some context for what you guys did at your E-Prep committee at the Met. Are you up? Can you do that?
I think we did this probably in May or something like that, when things were still new to us. But it's just a subject we discussed, and that over time, there's going to be consequences to us being sequestered from each other and the rest of the world. So I found some literature on the subject from the Red Cross, and I used that to kind of outline this, and then ran it past a couple of people in the building who are counselors, retired counselors, but then they took and kind of edited and fiddled with it. And so it breaks down into really three areas. First is what to expect. I mean, what does it look like when you're being socially deprived or getting anxiety over this? And then what can you do for yourself, and what can you do for your neighbors? I guess personally my experience is that helping your neighbors and friends is good therapy for what you can do for yourself. You want me to go into more detail, or does everybody have this?
I sent it out as an attachment to the invite, so I believe that everybody on this call should have received it. I hope so. If you didn't, maybe wave your hand or something and we can drop it into the chat. Or did Bill already do that? No. Yeah. I guess I was interested, Richard, if you want to, you're welcome to elaborate on the document itself, but I'm interested in maybe a little bit more commentary on how you guys have rolled it out. What was the response in the community? Have you had any stories, anecdotal or, otherwise, in terms of the impact that this type of communications has had for residents in the metropolitan?
Sure, and that part of this is not a huge success story. We posted this. A notice went out to all the residents saying that this was available. I do not know how many people downloaded it and read it, but the committee, neither the committee or the building has done any like official outreach other than just distributing to the residents. So I don't have feedback on that, John.
Looks like Bill did you drop it in the chat, Bill? Great. Okay, so folks, if you don't have it, you can open it as a PDF from the Zoom chat window. And then Bill, you put another, thanks, Richard. I appreciate that overview. And if you do have any additional feedback, if you could share that in upcoming Zoom forums with us in terms of how it's being used in your community and with the receptiveness of residents, I think we'd all be interested in that. Bill, you also had shared with me previously, and I think I see you posted in the Zoom group chat, the article from CDC.
Canadian, yeah. Well, and it's along the lines of of articles that you folks have been seeing, and it's looking ahead, taking this time now to decide, how you're going to isolate in times when it's not sunny and it's the days are shorter and all of that kind of stuff. The article I thought was interesting because it suggested people that both look at the importance of isolating and being in a bubble, if they have both adhered to these standards, if you will, that they could join together in a bubble. So, if you have two people that are alone that have not been socializing and things like that, they could go to each other's homes and watch movies or cook, share food, that sort of thing. It seems important to me, and I just don't know. I think what I struggle with is I just don't know what role the neighborhood association can play in this. I think we can do awareness building of the topic, but I'm not sure how we would go about actually leading it. Richard, you sort of touched on this. You've put the information out, but you're not actively organizing people into pods or anything like that. So I think that's where I'm sort of stuck to know what to do.
Well, I think in keeping with our general approach to emergency preparedness, I mean, a lot of this really is most effectively addressed at the grassroots level, and trying to do a top-down strategy from the neighborhood association, I don't think would be particularly successful. I think instead getting information out there to prompt the conversation at a hyper local level within a household, or perhaps between individuals who might today be communicating exclusively, via the telephone or Zoom, if they're trying to truly follow the guidelines strictly, and explore how are they doing. I mean, some people hold up better than other people. Folks who are misanthropes don't like people in the best of times, or they're probably thriving now in isolation. But others who are particularly social beings, like I know my partner is, she is really, it's hard. This is much harder on her than it is on me. I'll just put it that way, right? We have different temperaments. And so you might recall when we were talking about the twindemic and the webinar I had attended that was germane to assisted living or nursing home facilities. And they were talking really about sure the need to protect their residents, but that the loss of contact with family members was really having health impacts on residents in nursing homes, and they were proposing as a good practice in nursing home environments to weigh the trade-offs between the impact that on seniors of being isolated versus strict adherence to quarantine, and that there really is a trade-off here. And so the same thing is true for us living independently, regardless of our age. And the article that you shared, Bill, from Canada via the Canadian Broadcasting Service, it was, as you said, they're saying, folks could, if they are living individually, could pair up with another person living individually and violate the strict quarantine, share meals, get together, movie night. I mean, if they're both doing their jobs, minimizing, maximizing social distancing, then to bring those two households together, but still having those two individuals otherwise be isolated, really has a very limited increased risk for either of them, but it creates the opportunity to bust down that isolation and loneliness, and that's important.
Well,
So-
I think if I could add to Ruth Ann, you introduced us to somebody in your building, and who, as I understand, is doing this. This is what she is doing. She acknowledges that she was, I think, sort of paired up herself with somebody else in the building that is isolated, that doesn't have kids and so on in the immediate area. My thought was, if she was willing to share her story with us, as she did in the call last week, that I could use to share out. So instead of telling people, but sharing the idea, and someone here in the Pearl District that's actually doing it.
Okay, a lot of us in this building are doing it.
Okay. I would love to be able to profile you folks.
To be honest, when the subject came up, I was, based on my experience here, thinking how rough it is on couples. I didn't see the loneliness being particularly a living alone kind of situation, because in these kinds of environments, we've had, I think in LA they call them COVID buddies, that, you really need, to trust someone, and, they're not going places and, partying and have a great walloping time out there, and being careful. I'll talk to Barbara. Barbara's the one that does the Tuesday morning coffee now up on the roof. And she's kind of the food person, and food, of course, is, nobody's allowed to touch it, but it works. But getting back to the marriage thing, and living with someone, can also be extraordinarily stressful. And I know I'm friends with a couple, very young couple who are, you know, ready to get divorced. So, you know, it's like no joke here, you know. I keep trying to, you know, tell them that there's a lot going out. I mean, you know, if you want to get divorced, fine, but wait until after this thing, you know, clears. But so I don't think it's just, you know, people who live by themselves. I think it's kind of a thing, and domestic violence is up. And then, you know, there's just, you know, I've hung around couples who've been married for 40 and 50 years, and, you know, I think they're not reporting all as great. So anyway, I appreciate singling on us all single people here, but I've also found over the years there's a little bit, just a tiny little bit of thought that if you live by yourself, there's something wrong with you, or, you know, lonely and, you know, miserable. So there's stereotyping going on, you know, in some of these things. So I think it's everybody. And I think that's when a role of a neighborhood association comes into play. It's everybody. And so, you know, we're going to Safeway. We're doing things. So I don't know. I think there's a role, and even if it's just talking about it and letting people know that, you know, there is a thing, a buddy system, and, you know, a lot of people are practicing it. I think one of the amazing things about Barbara is she spends 2 hours a day on the phone with her grandson, who I think is like 3. I mean, he's a real little guy. And I thought that was really something. And, you know, they're maintaining a good relationship through this. So maybe, are there people out there that don't know how to use Zoom, for example? You know, should we have practice Zoom meetings so that I tried to do this for a friend of mine who's 88, so she could, you know, talk to more than one person at a time, but we had a hell of a time getting Zoom loaded up. You know, it's a simple thing, I thought, but so, you know, is the internet not available to people out there, you know, because they don't know how to use it? That would be something we could all, you know, maybe think, you know, maybe have a thing on Zoom that says, hey, you know, you want to talk to your kids more often on Zoom? Here's what you need to do. What do you think? I mean, things like that when everybody is impacted.
I think that's a great idea.
Martha, I think I saw your hand up.
Yeah, I just wanted to say, and thanks for that, Ruth Ann. I think that's important to say. It's for everyone. I think it is a role of PDNA as well as HOS to just say, how are you going to expand? You know, everybody's been in isolation, but as you start to expand, you know, how to do that carefully. Do you have a COVID buddy? Do you have, you know, can you, and this is what that is. This is how people do that. I think you can give some guidelines about that. And I thought the article Bill posted was great in terms of, you know, find another person who's similar, you know, and people are starting to expand, but we could give guidelines as to how to do that carefully.
Martha, I don't want to alarm you. There's a small human behind you running around.
Muted myself.
There's a small human running around behind you. I just wanted you to know. Don't be alarmed.
Martha, I think your point's well taken, and
There's a mask.
There's a mask. This is the Hannah Anderson mask.
Oh, I want to may I take a picture?
Sure. Oscar, can you say hello? Can you say hi? Yeah, there you go.
Thank you.
Yeah. Yeah, so we're doing childcare during this time. So, you know, that's our expansion of circles.
Bill, we can definitely pull something together, I think, right? We'll get
Yeah.
that posted. I certainly appreciate Martha's encouragement, and that's something we can do as a service to the community to provide some pointers. That article from Canada really does provide, I think, covers the basics pretty much, but we can flesh that out a little bit.
Ruth Ann, I sent you an email. If you wouldn't mind sharing my email and my phone number that I put in the email with Barbara, so that I could chat with her, that would be great.
Patrick,
Yes, I wanted to mention that there's technology available for seniors who are not really able to use computers and so forth. And we set up my mother-in-law, who's 94 right now, with an Amazon Echo Show, which is a video device that she does not have to touch or enter anything, but you end up setting it up so that you can drop in on her and then you just appear on the screen. Obviously, it's the polite thing to call on the phone ahead of time. So you arrange a time, but you just drop in using your software on either your iPhone or iPad or similar device, and then you just appear on the screen and you can have a conversation.
Wow.
And you can also load pictures onto that so that it's like a continuous slideshow of any photos that you want to turn in, to send to your elderly person who's a little more elderly than yourself. That's it.
Thanks, Patrick. So others, Howard.
Yeah, Patrick, what did you say it was? Amazon Show?
It's called Echo Show, and the show is intended to communicate that it's a video device, and there's 2 different sizes of it. And I can provide detailed sort of instructions if anybody needs help with that.
Hey, Patrick, maybe you could send Bill and I some information on it, and then we can see how we might adapt that and include that in some of our communications through our social media channels. Thank you.
Sure.
So I'd love to have a conversation. Others, what's happening either in your lives or in your communities? Richard, I saw your hand go up, but just, relevance for your community, your building, and what if anything's happening in your communities in terms of indications of need to focus on this, or people with solutions or responding to this. Would love updates along those lines. Richard?
Sorry. I was going to add to something that Ruth Ann said. I don't have a personal story right now, but she mentioned that domestic violence has increased. And that's also true for alcohol use and drug use. So those are other things that could be listed in terms of monitoring where your emotional health is.
Yeah, I saw that some statistic that alcohol consumption was up 17% in the United States during the pandemic. So I think people are definitely self-medicating. Anybody else want to weigh in or contribute in this conversation? Lindsay, you're muted.
I have a question for Ruth Ann. You mentioned Barbara in your building was doing coffees on the roof. And our building has tried to figure out how we can do some social activities when we can't do social activities. So how does the coffee on the roof work? How does she invite people? You're muted. You're muted, Ruth Ann.
Ruth Ann, you have to unmute yourself.
Basically, she sets it up, she and another person, she's always made the food for this sort of thing. So it's like muffins and eggs, and coffee is the main thing. And they just serve it, and everybody, gets served. Nobody takes anything. And we all stand, apart. It's never been real crowded, fortunately. There's not a huge crowd, and people come and go. And we have gardens up there, so it's very pleasant. And then, she managed to get it by management. You know, now she's trying to think what she's going to do for Turkey Day, Thanksgiving. She's very, you know, she's very intent on, and I think largely because we all realize that, you know, you just can't stay by yourself for these long periods of time. And yet people are. There are people in this building who are very frightened, and literally you do not see them. And then there's some, you know, that, you know, wouldn't go to a tea if you, you know, paid them. And then there's, you know, a lot of social people that, you know, we're willing to be careful. And we have, you know, I know she's working on the turkey thing. So
Does she just send a bl- does
social
she-
distancing.
does she send a blanket invitation to the entire building or by floor, or how does she?
Yeah, she just posts it. It's posted on each floor. And, you know, again, not every, you know, it's not packed. Usually it would be in the community room, and back when it was that, before COVID, there were more people coming. I don't know, you know, you know, I just sent her some of the rules for senior housing in terms of COVID, which I'll send to you guys through John. You know, that came out initially with no social stuff going on in this building. I mean, nothing. So we're inching our way back up a little bit. This is how Barbara's doing it. Thank God. So I'll keep you posted on what else she comes in. There's a drawing thing she does. I think she or someone else does that's they've started. So again, on the roof and socially distanced.
And are you saying that Barbara serves the portions of food on plates, on disposable plates, and then people can come and retrieve one for themselves so they haven't touched any
Yeah.
of the food, and then they stand, you know, they socially distance, either standing or seated outdoors, and eat their food, drink their cup of coffee, and talk to each other from afar?
Yeah, and then you can bring your own cup and your own plate, which is requested. So, but if you forget it, you know, there's things there. And yeah, again, you know, small groups, you know, 5, 10, 15 people is different than, you know, I was at a bar the other night, meeting a friend of mine, a younger friend, and I decided to go out to the garden to see what that was like. And oh my God, you know, it was, I mean, you're outside, but there was no social distancing, no masks. And I thought, oh, you know, I'm just, you know, praying, I guess, that, you know, these situations don't give way to, you know, a cluster. And then I think, I'm hoping that with the president coming down with it, that we might see a more active leadership in, you know, the mask wearing, especially that, and social distancing. 'Cause-
Ruth Ann, you're an eternal optimist.
That's an adorable thought, Ruth Ann.
Yeah, I know, you know, it's always good to be positive.
That's adorable.
I heard him saying that
He's infectious and he's leaving the hospital and exposing more people.
I know.
Really?
and saying,
Really?
hey, see, this COVID's not such a big deal after all. I've licked it, so don't sweat it, America.
Well, I will say that it's a real
Think about
study in contrasts. When you walk around the neighborhood, I have a dog, so I walk around all the time. And on the weekends, you wouldn't know anything was different. Like if you just popped out of a hole, you walk around and you know, thank God. I mean, there's, you know, supporting the restaurants and the bars and all that, but you're still left with this contrast of like, wow, how safe is this, and so on. But
Arlene, I see your hands up.
So several months ago, one of the other buildings mentioned that they had happy hours virtually by Zoom. So we tried that, and we had somebody who knew what they were doing and could break it up into small groups. We all met together and we all raised a glass, and then we broke it up into about 5 different small groups where you chat, you know, your neighbors, and And then you can press a button and the groups switch people, go in one group and out of another. And that was a really nice way to socialize and to catch up with people. And of course, after that, people, you know, got more in touch with each other because they hadn't seen each other in a while. And so I recommend that if you have someone who knows I know I spoke with Bill to see if he could help me do that. And you weren't savvy about it then. Is that still the case?
I've done a little bit of it. I'd want to practice on a friendly group that had low expectations. Like you may or may not see your neighbors again.
Arlene, I know what you're talking about. It's a feature called breakout rooms, and my company's been using it as well to get us more context as we're all working remotely. I will check, Bill. I think we have an SOP about how to
Oh, that'd be
work
great.
breakout rooms. So let me look into that for you.
Thank you. I appreciate that.
Thank you.
I think that's a great idea. I've often been on calls lately with 70 to 100 people all over the world, and we do breakout sessions. It's really quite amazing. And then come back together. It's really, really nice.
Maybe next week we'll test it out on you folks, or the week after yeah, maybe we'll plan on that, John. Next week is emergency preparedness meeting, but the week after we'll do emergency breakout practice, and I'll have mastered this.
Can you tell me the schedule? I missed that meeting about the E-Prep meetings as opposed to the COVID meetings. Are they?
It is the second Monday of every month. So it'll be next Monday, October 12th.
Yeah.
And it is at 6 o'clock. It's going back to 6 o'clock.
So at our regular time, 6 p.m., regular second Monday of the month at 6 p.m. And we just will hold that E-Prep meeting at 6 in lieu of the otherwise regular forum at 4 p.m. And I'll send an email invite out to everybody who's on the E-Prep committee invite list, again with the Zoom link and everything, Arlene.
Okay, thank you.
Well, anybody else, thoughts, comments? We'll try breakout rooms in 2 weeks. We'll
John?
reconvene. Yes?
Hey, John,
Yes.
this is Gwen. I'm on a phone.
Hi, Gwen.
So here at the Bridgeport, we have our building is split. So we have a courtyard in between. And our board purchased 6 folding chairs that all the residents have access to. They do have to schedule themselves, but it's to be used out in the open in our courtyard so they can social distance. And, you know, some people have met, you know, just to chat. And, but it gives them an opportunity to not meet in each other's units, but to meet outside and, you know, socialize for a bit in person, but with appropriate distance and wearing their masks. So.
Is this in the semi-private courtyard between the two buildings at grade?
Well, yeah, it's private property, but people pass through. And so there's enough room for people to keep walking through and to still have the group meet. Because there's a part of our courtyard that's wider, you know, the top of our courtyard.
So do you have any kind of a
So
protocol?
some people have done that.
Do you have a protocol about?
Well, the people, yeah, they schedule, they need to check a schedule or they can easily go in the room and check because there's only six chairs, and if nobody's using it outside, then they know they can use it. They do have to disinfect it after each use, and there's a supply of disinfectant in the storage room that they have access to.
Great, thank you. I was curious about that. So you can schedule them, but if they're available and not being used, you can use them. And then there's cleaning supplies and the expectation that when you're done, like in the gym, you're supposed to spray down and wipe the chairs before you depart.
Yeah.
Great.
And people have done it before, even before they set it out, disinfect it. So it's a before and after, you know, definitely after. But, you know, people have been doing it before also.
Right. Great. Okay. Well, anything else? It's
Glenn
10
has his hand up, so I don't know if he. I
Who
see
does?
Glenn's Glenn Traeger.
Oh yeah, Glenn, I see your digital hand is up. Hey, man.
Yeah, John, can you hear me?
Yes.
Okay, great. I was just thinking maybe something as simple as a phone call to everybody in one's building would show, that people care about you. And just that notion, I think would help many people of just in their more in their psyche. And I was thinking some buildings have like social committees. So maybe the social committee can maybe call every resident maybe twice a month or maybe once a month and just ask them how they are. And then for those buildings that don't have social committees, maybe like the management company could just call somebody and just say, how you doing? How's it going? It might be a really short conversation or it could be longer, depending on what's needed.
Could even be a voicemail message, but I mean, getting that reach out probably is beneficial. Yeah, I guess that sounds like a great idea. Obviously, management companies tend to have the phone numbers of all the residents. I don't know that EPREP our social committees necessarily have access to everybody's phone number unless the residents have opted in and shared them on some kind of a social list. So there may be some limitations in that regard. But Glenn, your point is well taken. I think just a call is great. And again, I think I kind of said at the top of this forum tonight, I mean, it's okay to reach out, right? Just to touch somebody and say hi. I think that goes a long way.
I think also we could share that if your building has an intranet or whatever form it uses to communicate notices, to share some of the things that we're going to start putting out on our channels. But again, so that you're at least bringing the topic up and it might lead to something. And I think that's our goal. I think as Martha said earlier, we do have a role in this. And again, if any of you have stories or examples like Ruth Ann and I were talking about with her neighbor, please have them contact me. I would love to write a blog post or something about them so that we can start to share this information in meaningful ways. Not just sharing articles, which is good, but real people that are our neighbors, connected to them makes them better.
Yeah, those are much more powerful. When people hear from Bill and me, it's like, God, I keep hearing from these guys. But if it's a unique story, human interest story about someone in your community, those are golden to us because it breaks the monotony of our droning on, and it's people can identify with it and help spawn, replication or adaptation of those small gestures. So please do share that kind of stuff with us. Okay, I don't see any other digital hands or any.
I have one other thing. I didn't have this information when I sent the newsletter out, but hopefully you're all subscribed to our e-newsletter for PDNA. And if you're not, go over to pearldistrict.org and join through there. But we will have Commissioner Amanda Fritz at our board meeting on Thursday night. She's going to be discussing one of the ballot initiatives regarding water, but also apparently open to other questions and so on. So please note that for Thursday night. And if you want to come, RSVP to communications@pearldistrict.org or to me, and I'll get you the Zoom information. That's all.
Great promotional. It'll be interesting to hear what Amanda has to say about that. Okay, folks, great to see all of you. Again, remember next Monday at 6 p.m. will be the EPREP committee, and then we will reconvene as the forum the following Monday again at 4 p.m. Don't hesitate to reach out to Bill or me in the interim with anything of concern or interest. And please stay healthy and safe, and hope to see you again next time.
Thank you, folks.
Good night.
Yeah.